So I think I'll just add to what Kamal said, and I think the recent regulation by the Supreme Court which said why doctors are charging $1.50 for a cataract surgery vis-a-vis 10,000 for CGHS and panel hospitals, I think that is the answer. It's my right to fix the nail at the cost which I want. It's my privilege, it's my right. So I have the right because I have been trained, and it's my charges which I, want and need from the patient. So I think it's better to sell our own cells rather than selling the product and the machine. So I think thanks Kamal for making me part of this wonderful course, and I think this course needs a bigger hall because this is a place where each and every one of us should discuss, and the whole game is how to make the patient satisfied. So it's all about the patient-centric practice protocols, and I am really impressed with the way Kamal has really worked, because at his center, if you see, it's what he wants, he delivers to the patient, and the patient actually becomes so gaga that he would always be looking for Kamal. They don't ask for the product, they just want 6/6/2020 Kamal Kapoor. I think that's the story, the success story behind this man. So I think patient standing in the patient's shoes is what is very, very important. Men is the measure of all things. I just clipped this, an overview of Picker's 8 principles of patient-centered care. I think much has been talked, I missed, but it might be a repetition. So respect for the patient's values, their preferences and expressed needs. I think this is very, very important. A patient coming to you, a patient who's driving, a patient who wants near vision, a patient who wants intermediate vision, a patient who needs vision in dark, I think that ultimately boils down to what kind of implant, what kind of surgery you are trying to go with the patient. Coordination and integration of the care, I think this is very, very important, because as a team, Kamal takes his entire team to Goa, 60 people flying on the same craft, enjoying 2 days. There's no discrimination between a doctor and a staff. I think that talks about oneness. If you see from the nursing staff perspective, how great they would feel to have breakfast with their own director. So I think the team has to be integrated. Information and education, as Dr. Satanshu has rightly said, every patient should be informed, well informed. You have to educate, you have to teach them. And that actually, the preoperative information which you have passed on to the patient, reduces the chair time which is required day 1 after the surgery, when you are trying to explain to the patient, oh look, there might be some glare halos. If the patient is pre-informed, they would never come cribbing for all these visual disturbances. The physical comfort, you always have to have that sort of bond, that interpersonal relationship when you're talking, addressing the patient with their first name, trying to give them something like a drink, a tea, coffee, and just trying to give them that pat. I mean, the kind of patient clientele that we are dealing is basically into two, the young and the old. I think with that compassionate attitude, I think the whole scenario changes. That emotional support and their elevation of fear and anxiety, I think that is very, very important, because patients keep on talking. A lot of times, I think the doctor is very good because he gives me some time, he relieves me of my anxiety, and definitely we as patients, when we go to a doctor, we also know how much anxious when we are as a patient. So I think that is very, very important. Involvement of family and friends, I think you need to, touch their kids, their son, their daughters who have brought them, their family and the friends, because they should all feel, yes, he's the doctor, he's the practice where I actually need to have my parents operated. So the continuity and transition, you actually need to continue the practices that you feel have been your roadmap to success. And yes, transition. We have seen young people, advertising, going on Google ads. You have to justify what your practice needs. And yes, there is always a need for a change. You should always shift, but shift to better practices rather than going to negative practices. I think that transition is very, very important. And the whole story comes in a compassion. You at times, as doctors, we always in our routine, we all do it. I know we all, seeing an OPD of 400, you always say, okay, make this patient free of investigations, reduce this. So that compassion, we all as human beings always have it. And I think that is very, very important, because when you look at the patient's perspective, patient really acknowledges your compassionate attitude. And this is being discussed at their home. And this is what actually starts rolling in more of patients. So I think these 8 pickers principle is what, we have been practicing and what we advocate and what we preach. So essentially, my talk is all about this. I'll not take much of time. A brief review. So you have to start with the understanding of the patient's perspective, what the patient needs. You need to assess your current process from the start to finish, right from the reception, the investigation, the diagnostics, and till the end. Use your analytics and reporting, because what is your EMR giving you? What are the analytics? You have to think outside the box and outside your specialty. Sometimes if you are a retina guy, you have to actually think in terms of not in your specialty, but give a holistic approach in terms of the patient care. Make your technology work for you and your patients. So deliver the best of the technology which is latest available, and try to hold that technology and be the first to have that technology. You have to have resources at every turn. A patient-centered approach puts the patients in the driver's seat for their own health, and get your team invested in the entire process. What we think is important may not be important to the patient, because you're talking in terms of visual acuity, talking in terms of pressures, corneal thickness, OCTs, but actually the patient is not concerned. What the patient needs is a 20/20 vision. What the patient has come to you is the comfort level, their treatment. So they are hardly concerned about all these diagnostics. But you might be caught up in the numbered game. So the research indicates that the patient care experiences are associated with higher level of adherence to recommended prevention and treatment processes, better clinical outcomes, better patient safety within hospitals, and less healthcare utilization. So what patient wants is a doctor who listens to them, who explains to them well. I think these are very, very important points, and gives them a hand of compassion. So I think these three things are very, very important. An extra chair time of 5 minutes during the preoperative workup is going to, take this patient all throughout, We as ophthalmologists usually have certain blind spots we think that we have given, but this short study showed that 100% of the ophthalmologists believed that they have talked everything, but hardly 2% of the ophthalmologists were actually listening to the patients. So overall 83% of our staff reports that they are not aware of the patient expectations, and 93% of the staff has not actually been trained. So when you talk in terms of your managers, your nursing staffs, your residents, they all have to be trained in terms of what the patient expects. They have to talk what the patient needs. How can we be more centered? So patient-centric protocols are, before the patient enters your OPD or the OR, I think vulnerable patients should be tagged. Any patient more than 70 is a vulnerable patient, a wheelchair-bound patient. You should acknowledge their comorbidities, and these patients should be taken on a priority. A note should always be done for the allergies. We have seen a lot of times patients allergic to Tropic Acid Plus accidentally getting installed, despite they having their allergic cards, because nobody has actually asked them, and the patient never feels that they have to be told about it. So care should be taken of these small petty things: cardiovascular diseases, tags of dilating agents, and the measures to curtail their waiting time. I think this is one of limitations pan-India with almost all of us, that the patients crib off the waiting time. So measures should be taken to curtail their waiting time, and it's not only pre-operative but post-operative. So whenever the patient enters your OPD, you always have to have smiling faces. I think one has to visit Kamal centers. I think the entire staff, right from the guard to the reception to the OR, they have smiling faces. Now that talks about their internal comfort with which they are working in that center. So your staff has to be taken care. They have to be always smiling, address the patients respectfully. You always have to have an eye contact. I think that is one very important thing, because that actually tries to reinforce within the patient, and you have to listen to them. You have to give ears to their complaints. You have to be sensitive to their needs, and the family has to be treated respectfully, and always try to make a connect. You can connect them socially with your relationships, with the connect that you have, and you have to then tailor their treatment protocols. So listening to them, and never start counseling before establishing a basic relationship. So I think I spend 2 minutes with the patient where I just start to connect, and then I actually start counseling what I want the patient or what the patient desires. So I think hearing is very important with the patient. And then you need to explain in simple words, explain what is basically, never start you have to explain in simple words. Explain why a particular investigation is required. The patient doesn't understand what IL Master 700 or an OCT or a Corvus or a Pentacam is. You have to explain in their own terms what you actually need with this investigation. A freedom of choice should always be given to the patient for the treatment that they require, for the kind of the surgical implants or the surgical practice that they require. There are certain fears with the patient. You always have to reassure the patients for their fears. The fear of, for example, recurrence of spectacles, their powers, their cataract, their disability, fear of going blind, the duration of the surgery, the inability to cooperate during the surgery. So allaying the fear is what is of paramount importance, and I think this actually saves a lot of your time intraoperative and post-operative. Pre-exposure to the surgery, you can actually take the patient for a pre-operative tour or for the do's and don'ts, explain the patient well what will happen on the day of surgery, and a brief post-operative instruction is what is, important. You need to give them time for their requirements, and a communication in their own language is very important. Telemedicine has a certain role to play. You can communicate, your staff can communicate patients. So to conclude, ask the patients about their expectations. I think this is very, very important, and their concerns. Patient-centric protocols around those expectations have to be built. You have to sensitize and you train the staff for the same. Encourage patient feedback. So I think we as a routine take a feedback from all our surgical patients, and this has actually helped us to improve our pitfalls. So this is one very important area which helps us to improvising and improving our own system. The aim should always be not just be a successful surgery or a procedure, but ultimately you have to have a surgically satisfied patient, because a surgically satisfied patient gets you more patients and gives you that level of satisfaction. So thank you once again, Kamal.
I think beautifully summed up by Dr. Sonu. I think the carry home points, all the audience are getting it. It's not just a good machine, a good surgery or a good IOL. Practice goes much beyond the surgical or the clinical skill. It is an experience. Give the patient an experience he will not forget. The patient will come back for more. You will be amazed how many patients we have in our practice. They come to me and they say, "Doctor, we got operated from you. I went for a morning walk. My neighbor was going to somebody else. Advance already given. I have got him to you." The advance has been foregone. So when your patients become your brand ambassador, no amount of competition can kill you. And 6 of my centers are in Delhi, and they are within 50 meters of very, very big names. We have never lost a single patient to any competition. In fact, it's just a matter of time. The word spreads that, okay, there's a good experience of going to this place. The patients will come to you. That is branding. And branding is not just one thing. Patient experience, social media presence, word of mouth, happy patient. It's a mixture of all. It's like a khichdi.
Thank you.
One important thing I would add to that. Doctor should never talk to the patient. This is my personal opinion. You may be different. I never talk to the patient regarding the payment.
Absolutely.
I just tell them these things are good. They ask me which lens. We have a diagnostic counselor separate. We have the surgical counselor separate. Diagnostic counselor stay with me in the OPD. And when I find out some diabetic retinopathy, I just ask them, you need an investigation. He will tell you. For surgical, I send to the surgical counselor. Surgical counselor sit with them. First, he asks them about the background, from they are coming, घर में कौन है, कितना पैसा कर रहा है. Then he has an idea कि how much he can invest. Then he start guiding them which type of lens he needs. Other 10 type of lens, patient gets confused. If you say understand the patient need trifocal, then he will talk about the trifocal if he can afford. तो हम लोग अगर पेशेंट से बात करेंगे पैसे लगता है डॉक्टर कमाने के लिए बोल रहा है, बट वो अंकल आंटी अम्मा जी पिताजी क्या क्या बोलता है तो उनको लगता है हमारा अपना बच्चा है, ये डॉक्टर तो है नहीं, इसका तो कोई फायदा है नहीं, ये अपने लिए नहीं बोल रहा, हमारे लिए बोल रहा है. तो never talk about the payment from the patient directly, doctor.
Just one more learning tip is, what we do in our practice is, suppose there is a lens which is very expensive and there's a lens which is a little less expensive. Never criticize the less expensive lens because you don't know the patient's pocket. So I use the magic word. Let's say EDOF. So I will say my favorite. I will not say the best, because who am I to say they are the best? Another surgeon will say something else. But the patient has come to me. So if I say my favorite lens is X. This is a premium lens. The similar lens is more affordable, works the same. Guess what? 82% of the patients go for the premium one. Yet, the ones who are going for the affordable one do not feel bad about it because you didn't say it is cheaper. Cheap or less or costing less to the human psychology sounds bad. If you can only learn this, just say this is more affordable, this is premium. That's it. And don't tell them the prices. Say, rest my counselors will help you. And you will see they'll go to the thing and say, tell the counselor, how about going in for the premium one? Please tell us about the premium one. Or they say, we can't afford, we want to go for affordable. So the counselor will not push a very expensive technology, otherwise you will loot the patient forever. So I introduced Dr. Anjani Khanna to you. She's a prolific retina surgeon. And she's going to be talking about, the medical legal. God forbid you've done everything. You've done everything which you could think of, and the patient is still unhappy, and how to prepare in case there is a medical legal thing happening. Dr. Anjani.
So very good afternoon to everyone. Now you've